Are you a patient that has gout? Are you a rheumatologist, a family doctor, an internist? Are you a person that sees patients with gout? Well, today I will explain to you a few things that they didn't explain to me in medical school. How much and why do we have gout? Well, most of the time we say 60, 70, 75% genetics. Means that a lot of people have genes, okay? And that genes, what they do? Well, they increase your uric acid. Not completely true. The genes per se do not increase your uric acid. What the genes does is decrease the glutathione in the cells that manage uric acid in your kidney. And now the uric acid stays in the blood. This is gross, really. It's not completely true. It's much more difficult to explain how the cell make it. But basically, these genes in all these cells that manage uric acid are oxidized. They have oxidative stress. And part, as you will see, truly, yes, is the alcohol, cheese, a condition that you will see that I will show it to you. But your father has gout. You most probably will have gout. What you will not have if you are intelligent are the consequence. Uric acid will be maintained in your blood correctly if you truly do not have diseases like psoriasis, like hemolysis. If you do not take alcohol, it's true, I will show it to you. If you do not take some medications, but the most important thing is to deoxidize that cells. And you say, well, I take allopurinol, and it's correct, but it's better to prevent the gout taking immunocal and taking an NRF2 stimulator like optimizer. Then now you can see perfectly, and you see here a lot of studies that says that has 65%, a substantial portion of the risk is passed through genes. Does your father has gout? Yes. Then you start your prevention. The second is they didn't tell me in medical school. They didn't tell me that if I deoxidize my cells with immunocal, I will be able to prevent a lot of diseases, but in this case, gout. Number 3, you can see oxidative stress and gout in PubMed. Remember, this is the National Library of Medicine, and this is very important. 400 studies about oxidative stress in these cells and gout. And I want you to take attention to this, because this, if you see, this is very important. Alcohol intake, what happened with the alcohol, what happened here, do you have hemolysis, psoriasis, lymphoproliferative disorders like leukemia, like polycythemia vera, some medications, aspirin, ACE inhibitors, cyclosporin, all the diuretics. Then, if you're intelligent, you pay attention to this. And for the rheumatologist, I didn't know about oxidative stress. I know that it played a role, but no one told me how these genes work in these cells that manage uric acid. I'm Dr. Scholcolff, and I used to teach clinical family medicine. I'm an associate professor at Northwestern. And also there, I didn't teach my residents correctly in the pathophysiology of gout and some other genetic disorders like this that say you have some genes, but remember, you can prevent and you can treat gout. How? Giving something that is a precursor of glutathione and is like immunocal, including decreasing the production of purines. You will be able to, with immunocal, prevent all the attacks for gout. Thank you and have a great day.